Well, good afternoon. As we safely and gradually reopen the province, we're putting tools in place to protect the public. When you face an invisible enemy, tracking and tracing is absolutely critical. And as I always say, you can't manage what you don't measure. It's why our government expanded testing. We passed 2 million tests the other day, and it's why we expanded contact tracing. And it's why we have the best and the brightest minds working on new methods of testing and tracing. They're developing the tools to help defeat this deadly virus. And as more businesses open, as we open our schools, those tools will be more important than ever. And today, I'm proud to support the launch of the new COVID Alert app. If you haven't already, please download it now from the App Store for free. This is an app made in Ontario by the best and brightest minds at Shopify who volunteered their time and expertise. And I want to thank the folks at Shopify and the Ontario Digital Service. You all are absolute champions. This is an app that puts your privacy first. In fact, it was developed in consultation with the Privacy Commissioners of Canada and Ontario to ensure the highest level of privacy. It's also very easy to use. Once you download it, you don't need to do anything else. It will run in the background. The app will send you an alert if you may have been in contact with someone who has tested positive for COVID-19. It will not collect any of your personal information, location data, or health information. And the more people who download the app, the more effective it will be. So please, everyone, please download the app and help do your part. This is going to be a huge help as more regions in Ontario enter Stage 3 today. And that's why we've also put in place some additional public health measures to protect patrons and staff at restaurants and bars. These include requiring customers to be seated at all times and keeping customer logs. My friends, these tools and measures are absolutely critical to ensuring our province reopens safely. And ahead of this long weekend, it's important for folks to download COVID Alert and please keep following the public health advice. Because my friends, we've seen what happened if we don't listen to the advice. A month ago, our neighbors in the US were heading into the July 4th long weekend. The numbers were down, schools were set to open in 4 to 6 weeks. Bars and restaurants were reopening. That long weekend, people went to parties, beaches, and gatherings, acting like COVID-19 was over. You just have to look at what happened since then to know how devastating it has been. Some regions aren't letting their kids go back to school now. Businesses have had to shut down again, and cases are at an all-time high. My friends, we don't have to go down that road. The future is in our hands, and it's up to us to write the next chapter. We have to practice physical distancing, wear a mask when required, wash hands frequently, and avoid large gatherings and parties, because it's the difference between our kids going back to school or not in September, businesses staying open or being closed once again. So please be responsible and think about others. On behalf of all of us, I want to wish everyone a safe and relaxing holiday weekend. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Bethlenfalvy.
Well, thank you, thank you, Dr. Yaffe, before I start, for your great work over this challenging time. And I'm very pleased to join Premier Ford today as we unveil another important tool in our fight against COVID-19. As Ontario safely and gradually reopens, it's more important than ever that we remain vigilant in our efforts to combat this virus. Today, we're proud to be the first province in the country to launch Canada's exposure notification app, COVID Alert. Aujourd'hui, nous sommes fiers d'être la première province de notre pays à lancer l'application canadienne de notification d'exposition Alert COVID. This is a new, Made in Ontario app that will help protect our families, friends, and neighbors. It's free, it's easy to use, and it's private. C'est gratuit, c'est volontaire, et c'est simple. And let me be clear, your privacy, security, and protection is our top priority. The app never collects your health information, location, or identity. As the minister responsible for leading digital and data transformation in Ontario, I want to assure the people of Ontario that we have worked closely with our federal partners and the Information and Privacy Commissioner of Ontario to ensure that your privacy and data are protected. So let me briefly explain how it works. The app assigns a random code to a user's device that pings other users of the app via Bluetooth when they are within a range of approximately 10 meters. The random codes and one-time keys are the only pieces of information collected by the app and are stored on technology infrastructure located in Canada for 15 days, after which they are deleted. Think of it as an early warning system. App users can learn faster of potential exposure and take action sooner to self-isolate or get tested. We encourage all Ontarians to download and use this app. The more of us who do, the more effective it will be. Nous encourageons tous les Ontariens à télécharger et à utiliser l'application Alert COVID. Plus nous serons nombreux, plus cette application sera efficace et nous aidera à stopper la propagation du virus. Ontario's digital teams have led the way in enabling a privacy-first product that works for people. The Ontario Digital Service, in collaboration with Shopify, created the code base for COVID Alert, which has been provided to the federal government for free and in perpetuity to support the development of the app and its use across the country. I'd like to thank them for their work on this initiative. Developing intuitive, user-friendly digital tools like COVID Alert is another example how Ontario is building a smarter government that works for you. We will continue to learn the important lessons that COVID-19 has taught us about the need to be more people-focused and harness technology to keep our community safe. Merci. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Good afternoon. Thanks, everyone. Premier, Minister Lecce took a lot of questions yesterday on around the plan and specifically around smaller class sizes, but I did want to get your thoughts on this as well, because this is easily one of the big concerns. We're getting feedback, especially from teachers and parents, reaching out saying that even with the caps, there's plenty of instances where those have exceeded. So my question to you is, was the possibility of smaller class sizes in elementary debated? Were you interested in asking if it was viable, doable? And if so, what put you over in saying they weren't necessary? Because depending on what enrollment is here at the TDSB, smaller classes aren't completely off the table. So what was your personal interest in that possibility?
Well, first of all, Lucas, I listened to you on the radio, and you made a great comparator to ourselves versus other provinces. We have the lowest cohorts in the entire country, of some of the lowest, smallest class sizes. We're putting approximately 500 nurses at a tune of $50 million. We're increasing spending by $309 million. On top of that, we're giving the boards $30 million additional dollars to hire more staff if needed. We're putting $50 million for cleaning, and then another $25 million for cleaning services as well. So we're pouring the money in there. But I'm the first to admit, Lucas, are we going to face a challenge? I'm sure we're going to face a challenge. But did we get the best medical advice we could ever get from some of the smartest minds in the country? Yes, we did. And talking about one of the smartest medical minds in the country, I'm going to hand this over to Dr. Yaffe. Thank you.
Thank you, Premier. I think we all know that it's ideal to have physical distancing of 2 meters between people, unless you're in the social bubble, and otherwise to wear a mask. And that is generally what's being recommended and being done. In the younger grades, the evidence so far from jurisdictions across the world in our experience with COVID-19 is that children under 10 years of age first of all, don't tend to get infected as much. If they do, they are very mild, or in fact, they're often asymptomatic, and they don't tend to spread it to other people. So, and of course, it's more difficult for them to wear a mask. But of course, it's optional, and we would encourage, if the parents are able and the children are able, for the children to wear a mask as well, and to maintain as much distance as possible. Of course, washing hands, all the other things, don't go to work or school if you're sick, all those things are important. Everything contributes to maintaining health, and we'll have to see how it goes and monitor how we can improve things as we go along.
Follow up?
Thank you. Fair enough. And actually, Dr. Yaffe, I'd appreciate it if you could take this next one. If you could expand a bit more on the conditions that would cause a cohort to go home, get tested, and isolate. You mentioned yesterday if there's evidence of a case, even a suspected case in a school, all the contacts of that case, be it a child or teacher, would be tested. But let's say a student or even staff, they get tested and they're positive. In that case, is the whole cohort getting tested and staying home too? If you could just give a few scenarios of what exactly would constitute, we've got to send everybody home.
Interesting you asked that, because I know that our staff at the Ministry of Health have worked very closely with the Ministry of Education on scenarios such as you described, so that schools will be able to understand what could happen if there is a case, because there's a lot of concern and anxiety. I do want to go back for a minute and say that, public health has worked with schools locally for many years. It's one of the common things that public health units do, working with schools when there's a case of measles, there's a case of tuberculosis, other things. So it wouldn't be the beginning of a relationship. It's building on a past relationship. COVID, of course, is, can be a serious infection. It's causing a lot of concern. It's a pandemic. So that's why we're going the extra mile. First of all, again, we're educating and hoping that parents will take this seriously and screen the kids before they go to school for any symptoms. And if they have symptoms, don't send them to school. If they go to school and they develop symptoms while at school, then the teachers and the staff will be trained on how to isolate the child quickly, notify their caregiver if it's a young child. Possibly test them if there's consent and if there's ability, or send them for testing with the parent. If we have one case in a classroom and the classroom is cohorted, we're looking at the people in the classroom. Whoever this child or teenager has been around we're talking about within 2 meters for over 15 minutes is the usual thing for contact follow-up. So to be safe, we take the whole classroom, including the teacher, the staff, and get them tested. And so one of the important things is having quick, reliable access to testing and getting testing done quickly and getting results. And if they were close contacts, the household, close friends, people they were around a lot, we would be asking them to stay at home, possibly the whole class, depending how close the class is. If we have 2 cases in the same class, it's the same as with one case. But if we start to have cases in separate classes, the first question will be, are they linked to each other? They might be friends. They might be siblings in different grades. And trying to investigate, do we think they actually infected each other somewhere outside of the school? In which case, the fact they're in different classes may not be as relevant. But if we find they actually infected each other at school somehow, then we're looking at 2 classrooms and following them up. It would be extremely rare, in consultation with public health, that a whole school would need to be closed. I remember my experience in SARS and in the H1N1 flu back in 2009-10. At the beginning, there was some panic, and school principals wanted to close schools. Almost never will this be required. Obviously, there could be circumstances if it's widespread, but I want to reassure people we will take every potential case very seriously, investigate them, make sure that contacts are identified, and isolated, and tested, so that we can make sure people stay as healthy as possible.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Oh, hi, Premier. Just to follow up on that nursing home staffing report from yesterday, it recommended 4 hours of care per resident per day. Do you like that? Yes or no? Can you do that? Will you do that? Do you think that's too much? Would it be too expensive? Or do you like it?
Well, Rob, I know the minister just received it yesterday. I think it was yesterday afternoon, and she's running through all the details. But there's no doubt, we need more staffing. Is it going to be that amount? I'd have to read over it myself and get briefed by the minister. But there's no doubt in anyone's mind that we need more staffing, and we need to support the existing staffing that's there.
Follow up.
I'll switch to the COVID app, and this might have to go to Peter.
Yep.
It's a little bit technical. I've seen some activity on social media today, people with iPhone 7s and whatnot being unable to download the app because it needs iOS 13.5 or better. So can you give clarification to people on what they can do if they're getting that kind of message? Is their phone just too old? Do you have a rule of thumb on which phones this should be working on?
Yeah, thanks, Rob, for the question. It's a good question. I asked the same question early on. About 90% of Ontarians have a smartphone. However, 90% roughly of this work on about 90% of Androids and about 80% of iPhones, and the reason is, and you got it, that they're older phones and they've either not been updated or don't have the capability to be updated. But I want to leave everyone, I'm not encouraging everyone to get a new phone because of that, but I am saying, and what the Premier said, and I think we want to see is people download this app. I wish I had my phone in my pocket because it's free, it's so simple, it's easy, and it would tell us, if we're standing close to each other for over 15 minutes, whether then it'll ping us, and if we have COVID-19, that it will give us an alert, and then it's voluntary on our part to be able to get the key that then will let the whole system know that you've been close to someone. And in countries where they've used this, the adoption rates don't have to be very high to really be an effective tool to supplement the contact tracing. So I really want to encourage people to download it and give it a shot. Thank you.
Next question.
Next question comes from Christina Tanalia from CP24.
Hi, Christina.
Go ahead.
Hi, everyone.
Hi.
Hi, doctors. Hi, ministers. Hi, Premier. My first question is actually for Dr. Yaffe. Dr. Yaffe, I know traditionally we have seen after the weekends, and there's a long weekend this weekend, sometimes an increase in COVID-19 cases. Mm-hmm. So starting today, this is the first time people in Toronto and Peel region have been able to gather indoors with 50 people with social distancing in place for months. Do you anticipate seeing a surge after this weekend in cases directly linked to maybe people not following the rules, especially with things like parties? And I'm wondering, you've discussed cases in Ottawa where you've been able to directly link private house parties to COVID-19 cases. Have you made the link in Toronto yet, or Peel?
Thank you for the question. The numbers of cases do fluctuate, and there's a lot of factors. One of the things is if people do congregate inappropriately, and if they are exposed to a case of COVID, the incubation period can be from a few days up to 14 days. So there might be a delay in seeing the effect of that up to 2 weeks from now. We wouldn't necessarily see it right away. Today, our numbers went up. I think it's at 134 cases. And I actually contacted the medical officer of health for Ottawa because they are continuing to see numbers, just to see, what are they finding? Is it still private parties, bars? Is it any impact potentially from opening stage 3? We have to figure out how these people are getting infected and implement strategies to reduce that transmission. And so we keep watching and monitoring and looking at the risk factors. Was this person a contact of a case? Were they at a gathering? And it's a big reminder to everybody as we open up the community, the businesses, the schools, the exposure notification app. These are all good things, but we still have to remember the basics. You know, you have your social bubble. That's the group you can be close with without protection. Otherwise, try and keep 2 meters away from other people. If you can't, wear a cloth mask, wash your hands, don't go out if you're not feeling well, all the usual things, because those are the things that are going to keep us as healthy as possible. And of course, when the influenza vaccine becomes available in the fall, get it. And try to maintain your health in many ways, you know, healthy diet, exercise, sleep, all those things contribute to keeping us healthy and safe. So yes, don't go out and mix in large gatherings. And as we analyze the data, if it turns out Ottawa tells me that that in fact is still happening, we need to look at that. How can we mitigate that? But it would be too early to say early in the coming week.
Follow up?
Okay, thank you, Dr. Yaffe. My next question is for the Premier. Premier, you have said more than once that you will, or the government will be reviewing everything when it comes to congregate settings. Earlier this week, you announced the commission into long-term care. What about looking into group homes and retirement homes, as you've promised? When will we hear an announcement about some kind of review, and what will that review look like?
Well, hopefully over the next couple of weeks, we'll be able to address that as well with congregate living and seniors. I think that's just as important, because any area with congregate living, as Dr. Yaffe will say, that it's not great. It's not great to have long-term care, 4 people to a room. We've reduced that down to two people to a room, and I think that should apply right across the board, no matter if it's seniors residents or other areas. It's extremely important that we limit the transmission of this virus within any setting. So we're working on that, and we'll be coming forward over the next couple of weeks with a strategy.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
I just wanted to go back to yesterday's staffing study on long-term care. Those working in the field know these problems. They know that there is a disaster brewing in these homes with a lack of registered staff and personal support workers, and they don't want to wait for another report and another strategy. And so they're asking you to commit to funding this immediately, to giving homes some money so that they can go out on Tuesday and hire for the positions that they need, including full-time positions with benefits. What do you think of that? Do you think that are homes able to fix this problem right now?
Well, we're going to have money there to hire more staff. That's a priority. We just have to put a number to that. And the minister received the report yesterday, and she's reviewing it, and then I'll be briefed today. I've been briefed a little bit on it right now before, but we need a full briefing on that, and then we'll be able to come out. But I don't believe in waiting. Let's make a move. A lot of long-term care homes are in desperate need of the PSWs and nurses and other support workers there. One area had 60 PSWs not showing up to work one time. That's concerning. That just puts a load and a burden on the backs of the people that are there. But we're going to fix the problem, and we're going to be better off than we ever have been. Nothing's going to be perfect, but we're going to move immediately on it. We aren't going to be waiting around. We'll be putting money for it, just like we did, Laura. We announced $1.75 billion for building new long-term care homes. We're going to address it in the same speed and the same fashion as we did that as well.
Follow up?
Thank you. And just on another topic on the app today, we're hearing from the Ontario construction industry some concerns about this because, of course, they can't have their phones while they're actually working. They're looking for a wearable component, and maybe some others in the manufacturing industry would be as well. Have you heard about any of these concerns? Are you pushing the federal government to allow for another app to work with this one for those who actually can't bring their phones with them to work?
Yeah, you mentioned that on the construction sites. I had a good conversation with Leona. They have their own app, and they want to bring it on construction sites. So, you know, I'm in favor of that, and that's going to be strictly up to the federal government to decide if they're going to allow them to do that or not.
Last question.
Last question comes from Lorenda Redekop from CBC. Please go ahead.
Hi there,
Hi,
Premier.
Laura.
The first is about some concerns and confusion with the education plan. With the younger kids, with the possibility of like 30 young kids in a classroom, is it expected that they would be able to distance? And then the other is regarding teachers. Given that there are going to be both online and also in-person classes, will they expect it to be doing both, and how would this work?
Well, first of all, we have the lowest class sizes in the entire country. You look at comparators, look at BC as well, and then the lowest cohorts in the entire country. I was getting briefed, and they told me it can be up to, in BC, up to 60, even up to as high as 120. So I think we're putting in a lot stricter protocols and guidelines when it comes to cohorts and class sizes. And I've always said this isn't a Doug Ford plan. This is a plan through public health, through Sick Kids Hospital, to some of the brightest minds out there. And I have to take their advice, and I will always take their advice, and I'll never waver from their advice. They're the experts. But maybe I'll ask Dr. Yaffe to come up. Thank you.
Yeah, I think, as I said before, optimally, we would like everybody to be able to physically distance 2 meters between each other, unless they're in their social bubble. It's not always possible, and that's when we recommend a cloth mask, if possible. And for grades 4 and up, that is mandatory. It's mandatory for teachers, I think, when they're teaching a class, to be wearing a medical procedure mask. Children under the age of 10, the evidence so far has shown that, first of all, they're unlikely to become infected, or at least to become symptomatic. And they're not usually the source of infection to others. So we can learn more, of course, but that is the experience so far across the world. So we'll do our best. We'll see what happens. I think that the teachers and the staff are cognizant of the need to distance as much as possible. And hand washing, there'll be very easy access to hand washing facilities in the classroom. The children will be taught about the importance of distancing and hand washing, and not going to school if they're sick, all those things. And as well, it is optional for children under grade 4 to wear masks. So some parents may choose to do that as well. And we'll monitor how it goes and evaluate.
Follow up?
Sorry, this next one is on behalf of a colleague regarding pandemic pay for frontline workers. Anesthesia assistants just officially learned this week that they will not be eligible. And these are workers who they're working right alongside other staff who are getting it. And these people have been putting themselves at risk during the pandemic, doing things like establishing airways for COVID patients. Why aren't these workers getting that extra pay? And what do you say to these employees?
Well, before I hand it over to Minister Bethlenfalvy, you know, we went out and 375,000 people, and trust me when I say this, I fought for even more. There's a limited amount of money from the feds and ourselves, and if it was up to me, honestly, I want everyone to get pandemic pay. Everyone's pitched in, but there has to be a line that you know, we consulted with the hospitals and other emergency services, who should get it and who shouldn't. And we came up with a very, very large number of 375,000. But again, everyone's pitched in. It's very hard. It's such a tough decision. But I will pass it over to Minister Bethlenfalvy.
Well, thank you, Lorena, for that question on behalf of your colleague. First off, I want to thank the federal government for this $1.5 billion program, which the Premier said, wish we had more, wish we could do more. It's the largest program in all of Canada. It is the largest temporary pay program in the history of the province. As the Premier said, 375,000 plus people. Wish we could have done more, but the purse was capped. And of course, over 2,000 employers. So there's a high degree of complexity, and I'm very proud of, and a big thank you to all those who are day in, day out, keeping our province safe. And, we're very encouraged that we could do this and do this in a timely fashion, and that we will continue to support in many ways our frontline healthcare workers. And as the Premier said, wish we could have done more, but $1.5 billion and over 375,000 people in Ontario is not bad. So thank you.
Thank you.
Thank you, everyone. Have a great weekend.